political with a small p presentation about health inequalities. I'm going to try and liven it up a bit by asking my two glamorous assistants here to hold up a map of health inequalities in Kent. We are in Thanet, as you all know. We've got usefully dotted here Ramsgate and Margate. It's a little bit too small to see on the map, but we have areas of huge deprivation in Thanet. What this means is that we have more than 50,000 people living in the most deprived conditions in the country, which is the highest proportion in the whole of the county. Thank you, assistant. You can probably take that down now. And we also have the smallest amount of the least deprived people in the country. Now, that's just words. That doesn't really mean very much. What it means is we have enough people to fill a Premier League football stadium who are living on low income, in bad housing and on poor diets. And inevitably this leads to problems with health. So while our mothers are gestating us in their wombs, if they are undernourished, if they suffer from a poor diet while we're growing, there's an increased likelihood for us as their children to have coronary heart disease, diabetes and stroke. Children born into deprived families are more likely to have respiratory disease, obesity and mental health problems. And we see these problems in abundance in Thanet. You heard me mention stroke there. Obviously, I'm going to come back to that at some point. People living in poverty experience chronic stress. Every day, their bodies are under stress from the worry and the trauma of living in poverty. And this has a negative effect on our bodies, day by day. Our DNA, which is the building block of life, is affected by the stress that we're under by living in poverty. And what this means is that the fibres of our being, the molecular makeup of our bodies actually changes in response to the stress that we're under. And these changes to our DNA can be passed down through generations. So poverty is inherited through the generations. The molecular changes that we experience pass down and are replicated amongst the children and the grandchildren of people who've lived in poverty. I'm not going to labour that too much, but what it points to is that we have lower life expectancies in this part of the country and in other parts of the country affected by poverty. Even the Kent and Medway Health Commissioners, who are the people responsible for some of the atrocities we've been hearing about today, acknowledge that women in Thanet, in the poorer parts of Thanet, can live 22 years less than women living in the wealthier parts of Thanet. So that's one of the most extreme examples of differences in life expectancy. Now, the 2012 Health and Social Care Act that we heard about in Alison's video at the beginning, it may have taken the power away from or the responsibility rather, away from the Secretary of State for Health to deal with the health system that we're all subject to. But it's left him with a duty of care to reduce health inequalities, on paper at least. And this is where I think we can make some sort of political mileage. That duty of care is also passed down to the NHS Commissioning Board and to the clinical commissioning groups that we've heard about. So the Health and Social Care Act says, and I'll read some of it to you, each clinical commissioning group must, in the exercise of its functions, have regard to the need to reduce inequalities between patients with respect to their ability to access health services and the outcomes achieved. So in order to reduce health inequalities, it acknowledges that people must be given equality of access to services and that attention should be paid to the actual health outcomes that they achieve by passing through that service. That, I think, is something we all need to bear in mind. Now, the proposal to move stroke services from Thanet to Ashford is a direct example of moving services away from the greatest need and away from people where the health inequalities are. This is, at the very least, immoral, at the most is criminal. We can actually hold them to account under the provisions of the Health and Social Care Act. We've already heard that there's a greater likelihood of stroke from birth in deprived areas. So inevitably there are going to be more people, and we've looked at the data and we know that there are more people in Thanet who are having strokes. So we can certainly bring that to their attention. And in fact, we haven't really talked about the successes of the consultation, apart from the numbers that we've managed to mobilise. But one of the successes of our campaign against the removal of stroke services from QEQM is actually that we've got some of the clinical commissioners now to start paying attention to the fact that we have huge health inequalities in Thanet and holding them to their statutory account to deal with those. Whether that will lead to the retention of stroke services remains to be seen, but at least we're trying to get QEQM Hospital back on the table as part of the options under consideration. We've also heard from Bob about GPs, and many other people in the room are obviously concerned about that. Here we have a problem with our GP surgeries, so our family doctors are seeing on average between 2,000 and 2,800 patients each. Just to give you some context, the national average is about 1,600 to 1,800, so our GPs are massively overstretched. Again, it relates to the fact that Carly mentioned that our STP is expected to make £450 million in savings over the next couple of years. So not enough money is going into the system, which means that our day-to-day care, never mind our acute care, is also suffering under the cuts and strictures that we're experiencing. In South Thanet, or in Thanet rather, at the start of this year, we had 17 GP surgeries. We now have 15, and one of the other ones is not being talked about in terms of the future planning. So we can really think about having 14. There's a plan afoot to condense these services. We've heard about centralisation and consolidation of services. They're building a couple of big super hubs at the moment, and the expectation is that many of the GP surgeries will voluntarily join these super hubs because they can't cope with the patients. They just cannot cope with the amount of patients that they're expected to see. GP surgeries are closing their lists to new patients. I phoned up this week to try and get an appointment for somebody at my local surgery who was visiting and was told that they're not accepting any new patients. They couldn't see someone even on a short-term emergency basis because there's a waiting list if new spaces become available. And this is the case for several of the 14 GP surgeries. We were told recently at a meeting at Thanet District Council of the Health Commissioners that our population is expected to grow from 145,000 to 160,000 in the coming years. We all in this room who are part of SONIK believe this is a gross underestimate, and the figures that are being used to calculate population growth are the wrong figures. If we look at ONS data, we can see that the growth is much greater, and it responds to your point as well, Lucia, that people are moving here all the time, so it's not just the kind of natural population growth, it's actually caused by an influx of new people as well. So all of this amounts to huge pressure on our services, too little funding and too few resources going into this hideously deprived area. The move from hospitals to the community, which is being talked about a lot, which is in some ways being used as justification for the closure of acute services, has to be predicated on preventative services and better services in the community, like GP surgeries. You can't just close the hospital and not do anything about your community services or your preventative strategies. It's lunacy and people will die. So this really is a matter of life and death. We're talking about removing services from the people who need them the most. I wasn't going to make this party political, but since Bob brought it up, I feel I need, as the parliamentary candidate for Labour in this area, I need to make the point that the Labour Party is doing something about this, both in opposition and with an eye on future government. There's barely a day that goes by when John Ashworth doesn't make a statement designed to embarrass the government about their attitude to the health service. Theresa May last weekend announced that she was putting £300 million extra into the health service a week, which was similar to the figure quoted on the side of those Brexit buses that we saw going around. It amounts to something like 3.2% going into the health system. The Institute for Fiscal Studies have said that's not enough. It's actually 4% that's needed to save the health service. John Ashworth and other people, he's the Shadow Health Secretary for those of you who don't know, have reminded the government that you don't just need to look at health, you also need to look at social care. If the Labour Party gets into government, we have guaranteed we will overturn the Health and Social Care Act of 2012. We will get rid of this legislation that discriminates against people and facilitates the privatisation of the NHS. We will ensure that the NHS remains wholly public. And we will also look at social care, of course. So I'll just wrap up by saying that the 70th anniversary of the NHS is approaching. If we want to see the NHS for another 70 years, we need to make the system sustainable. And the only way that we can do that is by putting time and money into the system. Thank you very much.